Hi everyone, I am Dr. Macy. Welcome to Foundation Chiropractic. We really appreciate you being here tonight just to be able to go over a lot of very important information. I know we cover a lot in that day one, and we're here to explain it just a little bit more in depth so you have a full understanding of why we do what we do in this practice, okay? So this appointment specifically in this presentation that I'm about to give you goes over some very commonly asked questions, some health and healing and how chiropractic really fits into that health and healing model, as well as normal versus abnormal x-rays, because we know we're not all x-ray experts. We want to make sure that everyone has a good, clear understanding of what those are supposed to look like before we take you back into your own private setting to go over your own personal x-rays and care recommendations so that we can have a good plan to move forward with chiropractic care in our office. Sound good? Perfect. Okay. So I'm sure all of you, or maybe you yourself, either know someone or have done this, where you take all the symptoms that you're experiencing, plug them into Google, and get some crazy disease spit out back at you. Has that ever happened to anyone? Me too. So that's totally okay, right? And it's a normal experience that people want to try to diagnose themselves, right? But even if you have those symptoms, that doesn't mean that you have this crazy illness or disease, right? That's not always the case. Although a lot of the symptoms that we experience are common symptoms of things that could be wrong with our body, that doesn't always mean that that's what's going on. But that's why we're here, to help educate you so that you do know what's happening within yourself and within your body, so that you can properly take the right steps to help yourself feel and function your best. Okay? Now, how many of you have used your symptoms to gauge your level of health? And if you don't have symptoms, you must be healthy. Yeah, me too. And that's a lot of what people use, right? They use those symptoms to say, well, I'm not experiencing pain. I don't have any cold symptoms. I'm not experiencing anything crazy. I must be healthy. But that's not always true. How many of you know what the number 1 and number 2 leading causes of death are in the United States? Anyone know? Yeah, I see a few people raising their hands. The 2 most common causes of death are heart disease and cancer. And generally, people get diagnosed with those not 1 or 2 days or 1 week after they start manifesting within their system, right? It's usually further down the road. Those things have to accumulate and develop before they start showing signs, right? Months or even years of time go by before people get those diagnoses because they don't have symptoms. They don't have pain. They don't have weakness. They don't have something going on telling them that something is wrong, right? And that's because the pain that we experience only makes up about 8% of a nerve, okay? That means 92% has nothing to do with pain at all. It has more to do with function, therefore shows us dysfunction of what's going on within our system, okay? That's why we do those scans. We take the muscle scan, we take the nerve scan to show us not only where we're experiencing pain, where that dysfunction is occurring, but also areas of dysfunction where no pain has started at all, because then we can address that before pain really starts to arise. And I don't know about you, but I would rather prevent pain from occurring in the first place rather than having to combat and deal with it later down the road, right? That sounds pretty nice. No pain at all, definitely. And that's where chiropractic care comes into things. So let's put it into a little bit more perspective of why we do those scans, why we take all the history information that we do to really get to the root cause of what is causing our pain and symptoms. This iceberg slide is a great tool and resource that we use to show patients what can really be happening under the surface, okay? So this iceberg, what is above the surface of the water, is the pain, the aches, the numbness, the tingling that people really experience that set off an alarm system within their body to tell them that they need to take a step of action, right? Either going to the doctor, going to a chiropractor, doing something, right? But what's below the surface, and I think we can all agree, the larger portion of that iceberg, is what has been manifesting, developing, degenerating their system before those symptoms above the surface, that smaller portion of the iceberg, even started to show itself. Okay, that is what we do. We address what's going on underneath the surface we do our assessments, we do all the things that we do to figure out what that bigger portion, when it started, what's actually happening, and how we can address it to not only help that heal itself, but also to take away those symptoms and prevent them from coming back. And I think that's very important. We also like to use this fire alarm analogy to really figure out what's happening and show patients what is going on within their system. So, when a fire starts in our house, does that alarm system go off right away? No, it does not. That flame, that fire has to grow, develop, and that smoke really has to start to accumulate before the alarm system goes off. That fire, that growth, that smoke is what's happening within our body before we start to have those aches and pains. That alarm that then goes off is that warning sign that something is wrong. Okay? And generally, when people have those warning signs, they do one of two things. First, they either ignore it completely, do nothing at all, and that would be like popping the batteries out of that smoke detector or just plugging your ears so you don't hear it anymore. Is that doing anything for us? Definitely not. Or two, they go to their medical doctor and they are told that they need to be put on some type of prescription medication or have some type of surgery. Again, that is not addressing the fire. It's only addressing the alarm. So yes, will those surgeries potentially turn off that alarm? Maybe. Will that prescription maybe stop your pain? Maybe. But it's never touching the fire. We in this office, we assess the fire. Because once that fire is out, what happens to the alarm? It turns off, right? But then what's left? What's left after that fire is put out? A lot of destruction, a lot of damage that has to be cleaned up and rebuilt, right? Depending on how big that fire actually was. There may need to be more repair, more healing, and it takes time and repetition in our system to make sure that we are back to full function without pain. Does that make sense to everyone? Yeah, but we're told and we're educated throughout our lives that the more medications we're on, the healthier we are. Is that the case? I don't think so either. I think it's actually the opposite, right? The more medications you are on, the less healthy you are. But that's how America becomes the leading consumer in those prescription medications, right? It's because we're told that that's what we need to do. That's how the average number of prescription medications on a daily basis gets to be 10 per person, right? On the average. That means someone's taking none, but then someone else is all the way over here taking 20. That's crazy, right? And I'm not saying that prescription medications or surgeries aren't useful. They aren't a valuable tool, because they absolutely are. I'm not here to discount that whatsoever. Because modern medicine and what we've developed has saved people's lives. It's amazing in that regard. But I think, and I think you guys can all agree with me, that those surgeries or those prescriptions are jumped to as a first resort far too quickly and far too frequently, when they realistically should be that last option. We should be taking more of that holistic approach, right? Looking at other options first before we recommend a surgery or a medication. Definitely. Now, I wouldn't be doing you a service tonight if I didn't tell you how we can achieve that, right? How we can achieve a healthier, happier, drug-free, surgical-free life. And that's through chiropractic care. We know through science that the brain, the spinal cord, and its nerves control every function that our body does every second of every day. Okay? It tells our heart to beat, our lungs to breathe, and our stomach to digest without us ever having to think about it. That's how I stood up here and talked to you for the last 7 minutes without having to think about taking 12 to 18 breaths, beating my heart to keep me alive, right? Digesting my breakfast or lunch that I just ate. I can do all of those things simultaneously while my brain is talking to you and I don't have to think about it. And I've known how to do that since I was born. And that's because the brain and the spinal cord are the very first thing to develop when you are growing inside of mom's uterus. If that wasn't there, the other life-sustaining organs that we have within our system wouldn't be present. It is that important. It keeps all of our other vital organs functioning at optimal level, at whatever 100% your body allows it to function at. Because everyone's unique. Everyone is an individual. I'm different than all of you sitting in front of here today. Now, there can be interference in that communication, meaning the organs that we have to supply electricity and energy and communication to can function at a lesser percentage than what they should be. Okay, and in different areas of our body, we can see different types of dysfunctions occurring. So in our neck, those miscommunications can not only lead to neck pain, but those nerves also go to our eyes and our ears and our nose. So we could have eye troubles, hearing problems, sinus problems. In our mid-back, those miscommunications can lead to pain, yes, but we can also see dysfunction in our heart and our lungs and our stomach and esophagus. So maybe we have acid reflux or high blood pressure or heart irregularities or breathing trouble, right? Asthma is a big one. In our low back, we not only can see from those miscommunications pain and those types of symptoms, but also problems with our digestive tract and our bowel and bladder and our reproductive organs, and pain into our legs, right? Sciatic pain, that's a big one that people experience. So as you can see, because that brain and the spinal cord and the nerves control every function within our system, when those aren't functioning right, we see a lot of problems in other areas of our body. Does that make sense? Yeah, and that's like when people come into our practice and we get their body adjusted, their whole body, because we focus on whole body wellness, they not only see improvements in their areas where they're experiencing symptoms, let's say it's low back pain, but they also experience improvements in digestion or sleep, or they have better mood or energy, because their whole body's performance is elevated. So they're functioning better overall as them as an individual. And that's awesome. Now, in chiropractic, we call those miscommunications subluxations. You're going to hear us talk about that a lot in this practice because we love to educate patients. And this is a word that we use probably in every single adjusting room every day that we're talking to patients. Now, on the left here, we see a normal spine that is subluxation free. Those bones look like nice, big, fluffy marshmallows. Those blue spaces in between them, those are our discs. They are nice and hydrated and healthy so that there's enough space for those yellow nerves to come out of the spine free of those communication problems. They're flowing nicely. On the right side, we have a spine that has had a subluxation present for weeks, months, years. We can see that the bones don't look super healthy anymore. That disc space is red, irritated, unhappy, and that nerve that's trying to leave the spine in that area is not providing 100% function and communication to whatever area of the body that's occurring in. Now, if this happens one day and we leave it for one day, it's not so bad. But it's that repetitive trauma that we put onto our body and that subluxation progressively getting worse and worse and worse over time that we see a lot of these dysfunctions occurring that then lead to aches and pains down the road. Now, that looks pretty painful, right? Sure does. Do you think you'd feel that right away when it happens? Sometimes, yeah, but not all the time. Maybe it's a big physical trauma, right? A car accident or a sports injury or a fall. You might feel some pain, right? but is the first thing that people's brains go off of thinking, yep, I have a subluxation, I need to get to the chiropractor? No, not always, unless they have that education and that knowledge that that is what is happening and they need to get it addressed, right? So those big physical traumas are not the only thing that lead to those subluxations, right? It can be a lot of other things. We talk about 4 major types of stressors that can lead to these subluxations occurring within our spine. That physical is a big one. We're going to save that one to the end to discuss it a little bit more. But we have 3 other types of stressors that we experience on a daily basis, multiple times in our day, that can lead to those subluxations as well. We talk about mental or emotional stress, right? How many of you have mental or emotional stress? Yeah, something stresses you out. Yeah, me too. That happens in everyone's life. I don't think I've ever met a single person who doesn't have stress within their life. But it's a normal experience, and it's going to happen. So let's have chiropractic care help our body handle that better, right? Because when we get stressed, our muscles get tense and tight, and our shoulders start creeping up to our ears, right? Because we get anxious, we get tense. Well, those muscles are attached to those joint spaces that occur in our spine and pull those bones out of where they're supposed to be. That leads to those subluxations. And over time, that can get worse and worse and cause dysfunctions and pains. We also have chemical stress. Big ones that I like to think about when I talk about chemical stress are food and drink. Everything that we put into our body is not always healthy, right? We try to be as healthy as possible, but it's not going to be 100% of the time. And so some of the foods and drinks that we intake have more inflammation within them. So that inflammation is going to go into our system, right? And it doesn't just stay in our stomach and our digestive tract. It goes everywhere within our body. And our spine is not off limits. Meaning that the more inflammation present, the more it's pushing on those bones and irritating those nerves, leading to those subluxations. We also have environmental stress. Has anyone heard of barometric pressure? Like when a storm comes in? Yeah. When that barometric pressure goes up or down, our bodies have to adjust to that. The pressure in ourselves changes, and that can put more pressure on those areas of our body, leading to those subluxations. Physical stress or trauma. Okay, there's 2 different kinds that we talk about. Big physical traumas, right? I had mentioned some car accidents, maybe a sports injury, maybe a big fall, absolutely can lead to those subluxations. But it's the more repetitive things that we do on a daily basis, right? How many of you work for a living? Everyone, right? And most of the time, people work, let's say from age, we'll give it 20, okay, to 65. How long is that? 45 years of your life, right? 45 years, most people are doing the same or similar things throughout that 45 years, right? So maybe you're sitting for 8 hours a day, or standing for 8 hours a day, or you drive for 8 hours a day, right? Whatever it is, you're doing that for a long period of time. And if we're not addressing the stress that we're putting onto our body at that point and maintaining, pain-free lifestyle, making sure that our posture is good, all of those things, we are putting stress on our system that's causing small subluxations, but when left, accumulate and grow and get bigger and further subluxate, leading to dysfunction, leading to pain, leading to aches that we then have to try to combat and hopefully we can fix. Now, to put it into perspective for you, picture a 5-year-old kid and he's on the playground on the monkey bars, right? And he falls and he causes a small subluxation in his mid-spine. Now, is his first thought to get up and he's got to go to the chiropractor immediately because it's causing a subluxation? No. He's not running to mom and dad and saying, I fell, and mom and dad are saying you need to go to the chiropractor, unless they come to Foundation Chiropractic, and then they probably are bringing them in, right? But if they don't have that knowledge and mindset, that's not the first thing they're going to do. They're going to tell that kid, get up, you got to learn, so you're just going to go on, keep playing, keep doing the things that you need to do. Okay, so nothing happens. And it's not so bad in that instant, But if we don't do anything about it, it's not going to correct itself. It's not going to get better on its own. It's going to progressively get worse until we start seeing more dysfunction and then leading to aches and pains. So fast forward 10 years. Now that kid is 15, right? And now he's trying to play sports, soccer and track and all the running. But he can't keep up with the other players that he's trying to play with because he's having trouble breathing. And so he goes home and says to mom and dad, I'm really having trouble breathing when I'm playing my sports at school. And then they think, well, I need to get you to the chiropractor because you have a subluxation, right? No. They're going to take him to his pediatrician and he's probably going to get put on some type of medication, right? Some type of inhaler or prescription to help him with the symptoms that he could potentially be on for the rest of his life. But that's never addressing the root cause of what is actually leading to all these symptoms he's experiencing, right? That subluxation in his mid-spine from when he was 5. So he's going to grow and develop a lot in those 10 years, right? Boys shoot up like a weed, right? They go from 2 feet to 6 feet in a day. Now, do you think his spine grew nice and straight and healthy the way that it was supposed to? Nope. Because the body is really great at compensating for those subluxations, but it doesn't always do us good. So his spine probably didn't grow very nicely, which leads to curvatures and changes in the structure of the spine and how it's supposed to be or how it should be for normal function. Now, if a spine comes in like this, it's harder to address, right? So that's why we want to correct it earlier, right? Because do you think it's easier to take care of someone who's 5 and hasn't done a ton of damage to their spine, or someone who's 65 and has worked 45 years of their life? From experience, I think I'd rather work on the 5-year-old, right? Because not only can I help them grow and develop and hit milestones the way that they're supposed to, but I can also do my best to take care of and be proactive about their health, to make sure that their spine doesn't, form incorrectly, that they grow up to be nice and healthy, and they can keep feeling and functioning their best all throughout school, sports, and their working life. So they don't have all of that damage and degeneration as someone who is 65, who hasn't done anything to take care of their spine. Okay? Now, we picture it in phases, right? We talk about little kids who are 3, 4, 5 years old, and they maybe need to, in a year's time frame, have their spine adjusted every other week, right? So 26 times in a year. So let's say for, just ease sake, they maybe need 20 to 30 adjustments, right? Because sometimes they're growing, they may get sick, so they need more frequent care. As we move up in the age ranges, they're doing more things, right? They're more active, they've had more damage done. They need more care, right? So someone who's 10 to 18 years old might need 40 to 50 or a little bit more in adjustments. So you can see as we get more degeneration, more damage happening to the spine, more stress that we've put on our body that's inevitable, we need more care. And so you get someone who's 65, who's had manual labor jobs for 45 years of their life, who's done nothing to take care of their spine. They need a significant amount of care to truly not only help them with pain relief, but also help them get to the root cause of what's actually happening within their system and prevent that pain from coming back. So someone who's 65 maybe needs 60 to 70, 75, 80 adjustments over a year's time frame to really hone in on what's actually happening and correct it and maintain their spinal health. And that's why we break care up into different phases in our office, right? We talk about stop phase and stabilization phase, and I want to bring back my fire analogy because I think it's really valuable here. So that fire is big, right? In that initial phase where we're trying to figure out what's going on. We're trying to not only stop the alarm, but also put out the fire. And so that is our stop phase of care, where we have a lot of firefighters here trying to put out all of that fire and start to really work on that damage. Okay, so we see you at a higher frequency, but for a shorter amount of time, right? It doesn't take years to put out a fire. It takes maybe a couple hours or a day, depending on how big the fire is, right? But in the sense of our body and our system, it's going to take a little bit longer, right? So we see you for a higher frequency, but for a shorter amount of time. That's that stop phase of care, okay? Then we move into stabilization phase of care. And that's where a couple of those firefighters leave, and we're really starting to just make sure that no more fires erupt, right? And we make sure that we have everything cleaned up so that we can rebuild, right? We're assessing the damage and we're fixing it at its root cause. So we take some away, we see you at a lesser frequency, but for an extended period of time to make sure not only that that fire doesn't come back, but that we really clean up and fix the damage that's been done. Then we can start talking about maintenance and wellness care, right? Where we're rebuilding that house, making sure that everything is functioning the way that it's supposed to, making sure that we're checking for, dead batteries in those fire alarms, putting fire extinguishers in, making sure that everything is working how it should be so that we don't have that problem again in the future. Does that make sense? Yeah. And that's how we approach care in this practice. We don't approach it from a pain-based model. We approach it from a wellness-based model, where we're not just here to say, come in, we'll get you out of pain, we'll see you again when you need us. We're here for the long haul. We want to see you not only to get you out of pain, but to repair and heal your spine and keep you out of pain for the rest of your life. Now, talked about a lot of care. You're probably sitting here, this is a valuable question. How am I supposed to afford all of this care that we just talked about? Because it's a lot. Well, that's easy. You just take all of the stuff that we're recommending to you, send it to your insurance, they'll cover it all, no questions asked. Is that how that works? No, I see some of you chuckling a little bit. I wish insurance worked like that. That'd be awesome, right? But unfortunately, that's not the case. Now, what they do is they take your information that we have sent them from that initial appointment. They've never met you. They've never spoken to you. They truly don't know what you have going on aside from what we have told them, right? So maybe how long the problem has been going on, how many days you experience it, the level of pain at its severity. They take that information, they plug it into an algorithm, and they spit out a number to you. Okay, so maybe you had 20 visits, that's what your insurance told you had, but they're saying 8 is what's going to get you out of that pain, okay, or help you have some relief, right? So that's all they're going to cover for you. And they do that because they go off of Medicare guidelines. And so I'm going to read this to you. Services that seek to prevent disease, promote health, and prolong and enhance the quality of life, or maintain or prevent the deterioration of a chronic condition are deemed not medically necessary. Meaning that anything that's going to keep you functional, keep you out of pain, and prevent a chronic condition from furthering itself, they don't have to cover. And that's because health insurance is a business. You don't need them when you're healthy, right? You need them when you're sick. And so they want to cover the least amount possible so that you continue to need them, right? So we create cash options that are more beneficial because if insurance is beneficial for you to use in our practice, you often have a super high copay or a really high deductible that you have to meet that makes it less cost effective to use. So we offer those cash rates to make it more cost effective for you in this practice because we want to offer you chiropractic care that is with ease in that payment aspect. Does that make sense? Yeah. Now, lastly, we're going to be talking about x-rays and what a normal x-ray is and what an abnormal x-ray is so that you understand before we go back into your own room and discuss them. Now, this here is an x-ray of your neck from the side view. What we are looking at is curvature. That curve should be anywhere between 30 and 40 degrees. That is normal. That helps the spinal cord and the nerves flow freely and exit to whatever area of the spine they're supposed to exit to. We also look at forward head carriage. That should be 10 millimeters or less. That is how far forward our ear sits in front of our shoulder. It should be relatively neutral. We're also looking for good healthy bones, that they look like those nice fluffy marshmallows like we talked about. Good healthy disc spaces, so the space in between those bones is nice and plump and hydrated so that our nerves do have a good space to exit from. Now, if a normal spine comes in, we want to make sure that it stays pretty and normal, right? Maintains those spaces that we were talking about. Because if we don't do that, it has the potential to regress, and that is not what we want. This is phase 1 of degeneration, okay? What we see change here from normal to phase 1 is that curve has straightened out, right? The disc spaces still are pretty good. The bones themselves still look pretty healthy. That curve is really the biggest thing that we notice the change in. Now, to get from a normal spine to this phase 1, it takes about 5 to 10 years. So a significant amount of time to have this degeneration happen, but a range, right? So if you have had more stress, more trauma to your system, we're looking closer to those 5 years, right? But if we have those repetitive traumas, 10 years, which seems like a long time, right? It's not that long in the grand scheme of things to get to this phase 1 of degeneration. So it's important to correct this, right? Because if we don't, it doesn't get better magically. It will continue to degenerate and get worse. Okay, now the good news is, yes, it takes 5 to 10 years to get to this level. It doesn't take that to come back or to really help that curve improve. Okay, we're looking about 9 to 15 months, but still around that year's time frame. That's why we make care the way that we do, because even that first phase still does take time and repetition to improve that and make it healthy again. Okay, now a lot of people come into our practice with no pain. Maybe they have some stiffness or range of motion problems, but not a ton of pain associated with this. You could have pain, yes, but oftentimes, no. They don't even realize that their neck has straightened out this much. So we need to address it, because if we don't, it's not going to get better. It's going to get worse. Okay. In this phase 2, we see that the curve has again straightened out. Those disc spaces are starting to narrow out more, and we're seeing more bone formation called bone spurs off the front of those vertebral bodies. Okay, that's the body's best effort to stabilize itself and try to prevent further deterioration from occurring. Okay, when that happens, when those bones have extra formation and when the discs start to narrow, there's not much we can do to bring that back, right? But maintaining this so that it doesn't get worse is our primary goal. Now, it took 5 to 10 years to get to the first phase. From here, it only takes 10 to 15. So we've not only gotten worse, but we've gotten exponentially worse and far quicker, right? Because it only took 5 years instead of 10 in the first scenario. If we don't do anything to this, again, it's not going to get better. It's going to continue to degenerate and get worse. Moving into phase 3. Phase 3 of degeneration takes 20 plus years to get to. Okay, so again, not just worse, but exponentially worse. And in this aspect, in this regard, maintaining this spine is our goal. Preventing it from getting worse. Improving function, improving range of motion, helping you feel and function your best, still with your spine looking like this. We want to get you out of pain. Okay, we want to help improve your quality of life, preventing this from deteriorating even further. Does that make sense? Yes. Now, this is where I like to talk about my chiropractic story. It's not about myself specifically, it's actually about my grandma. When she was working, she worked for 40 years of her life as a hairstylist, so she stood for 8 hours a day, 5 days a week, right? We talked about repetitive traumas being detrimental to the system. She started to experience low back pain towards the end of her working career, okay, to the point where she was having really bad pains down the backs of her legs, was having more stiffness, harder to stand throughout her day. She went to her medical doctor, had some x-rays, MRIs taken, was told that she had that phase 3 of degeneration plus in her low spine with some cord compression as well, to the point where she was going to need to have a surgery. So she had surgery to remove some of that disc space as well as fuse the lower vertebrae of her spine. Okay, now, unlike some people, she did have some good pain relief, but it never fully went away. And that's not the circumstance for everyone, right? Not everyone has pain relief after those surgeries. But she had to make adjustments to her lifestyle, right? She had to retire a little bit earlier than she had anticipated. She wasn't able to do all the things that she loved to do. She had to make adjustments to how she was living because of her pain and her low back symptoms. Now, fast forward 10, 15 years, those symptoms started to come back again. So she was having more pain in that low back, more pain down her legs, and weakness to the point where she was having more frequent falls. So she went back into her medical provider, had more x-rays, more imaging taken, and was told that that degeneration had not gotten better on its own. Even after the surgery, right? It got worse, progressively worse. So she had to have not a second, not a third, not a fourth, but another fifth surgery to maintain that low back that she was now experiencing, that degeneration. She then went through a year of rehab just to be able to stand up and walk a couple feet on her own. She is just now starting to return home again to be able to function even at 20% of what she was supposed to, or what she should be now, what she was before. So now she spends 90 to 95% of her life in a wheelchair, and she will for the rest of her life. Because she wasn't proactive about that health. She was more reactive. And that's not what I want for any of you. And I don't tell you that to try to scare you to think, if I have this phase of degeneration in my spine, I'm going to need a surgery, because that's not what I think at all. I actually think the exact opposite. That if I could have helped my grandma when she went through that first round of surgeries, she wouldn't be where she is today. But that's why I tell you this, because I know that with chiropractic care, even with phase 3 of degeneration, we can help you feel and function your best to avoid that surgical route, because I know I could have done that for her. And so it's my life's passion to make sure that I help as many people as possible to try to make up for what I couldn't do for her. That's why I talk so passionately about chiropractic care, because I know it works. I know it can work for every one of you, and I know it would have worked for her. Now, to leave you on a little bit of a happier note, these are just a few of our practice members that come into our office each and every day. People that we get to help feel and function their best and live that happier, healthier, drug-free life. We get to take care of everyone, all ages and stages, and it's awesome to be able to see them achieve their goals, not only through health, but through life as well. Now, if there's anyone that you thought of while I was talking to you today about those symptoms, about those experiences that you could have that could be related back to chiropractic care, please write their information down. We have that sheet. It's called our Hope Sheet. You can write down their contact information so that we can offer them the opportunity to come into our office and achieve the same type of information that you did to be able to take those next steps on their health journey as well. Thank you.